And this way, healthcare will become connected. At some point in time, we will share data in a private fashion, but useful to learn novel knowledge. The only thing I was semi-excited about the Apple Watch was not a lot. One thing, one feature. I can measure my heartbeat, nothing special, but I can measure my heartbeat linked to my social network. That's already better. And you might argue, why should I do that? Well, if you send me a picture of your new girlfriend or new shoes, I might get excited, and I might be willing to provide my heartbeat once a day, a number of times a day. And if one person does it, doesn't matter. But if that person does it, and a few 100,000 other people do that, and you start to see a number of things, you know where I am, that my heartbeat, the 1st of January was X, but the last day of December was X plus so much, might then be an indicator, with other things, that my heart is not doing so well. That kind of thinking, if it's non-intrusive in a private fashion, will start to help making healthcare social. This is a thermometer, which not just measures my temperature, but tells which diseases the people in my neighborhood have. So I know, well, if everybody has a throat infection, the chance is pretty big that my child will have a throat infection as well. That kind of thinking. If I get a heart attack, the key thing which should happen is that I'm being rescued within 5 minutes. Every extra minute lowers my chance to survive with X. One single button sends an SMS, nothing fancy, an SMS to everybody in 500 meters in my neighborhood who was willing to submit to a site that he or she has a EHBO education. That kind of thing you're going to see. Diagnosis becomes helped with digital. This is when I'm going fast. So we had biology, we had lifestyle. Of course, that's not all. My environment determines quite a big thing as well. As an asthmatic or as an allergic person, I would love to be informed by fellow asthmatic or allergic people. And this is something from Propeller Health, fantastic. The push on my the inhaler sends, if I like that, I can put it off, of course, sends my location to a website and warns other people that maybe today I shouldn't go to this forest because there is a plant growing in that forest with seeds for which I'm allergic. Wouldn't you like to get a reminder on your watch, on your whatever, saying, well, Mr. X, Mr. Y, today, don't go there. Cities like Chicago are installing lamps which do have sensors in it, which do measure pollution in the environment. This is one for at home, measuring humidity, UV, pollution, big thing. I want to be warned if something is better for me to avoid. Okay. Which brings me to the fact that if this knowledge becomes linked, social, that we start to look to healthcare like we look to other things. If you buy something, what do? You check price or recommendations on the web. There is almost nothing you buy without checking for price or for comparisons. But not for your doctor. Why do you go to the first hospital, the first doctor? Maybe that's not the best hospital, the best doctor. You will start to see reputation management. You will start to see websites saying that this doctor is better for X or this hospital is better for Y. It's something we need. We cannot offer every kind of care in every hospital. We will have really specialized centers according to the care to deliver. And we start to crowdsource. I don't know everything. You don't know everything, but the crowd might know. So this is CrowdMed. CrowdMed puts very tough cases on the web and asks people to suggest what it can be. Finally, I mean, why should you, doctor, know your disease? That's fine, eh? But the chance, if it's something rare, is pretty low. And we have 8,000 rare diseases. Finally, we start to make healthcare social.